Ashutosh joined with me sometimes in July of 1987, 88. And I was already here as a hospital service senior resident and as the first ever actually in the institute. And then we started our journey together, and finally we started our MCH from the 1st January 1989 under the mentorship of Professor Mahen Bhandari. And he is here today. It is exhilarating to see him. And I must let you all know that the department which he started was always one of the best. And this year, after the NEET started, the third consecutive year, we are having students within the first 10 of the merit. And this year it is number 1, 2, 3, and 5 have joined the Department of Urology as SGPGI. With this, let me tell you about Dr. Tewari, who did his undergraduate training from GSVM Medical College and had an illustrious medical career with 17 gold medals for outstanding performance in the university exams. And of course, we did our MCH together here, and then he immediately went to US after that and started his fellowship in urologic oncology at University of California, San Francisco, subsequently at University of Florida. In 2004, he completed his urology residency from Henry Ford Hospital in Detroit. While at Henry Ford, he was part of the team that performed the first robotic radical prostatectomy, I think, in the entire world, not only in the United States, but in the entire world. Today, he is the chairman of Milton and Carol Petrie Department of Urology at Icahn School of Medicine at Mount Sinai, and is a world-renowned specialist in prostate cancer. As director of the department, he leads a team committed to improving prostate cancer treatment, research, and education. He has performed by now more than 8,000 robotic radical prostatectomy surgeries, and his lab is currently working on unlocking the genomic causes of prostate cancer and translating genomic information to practical physician application through imaging. In 2012, he was awarded the American Urological Association Gold Cystoscope Award, which is given to somebody who within 10 years of his completing residency and has done a significant work in the field. Ever since, he has held several leadership positions, both at domestic and international platforms. I'll tell you that he has a special attachment with and great personal affection with me, and we have been associated not only during our journey during the MCH and pre-MCH days, but also later on as well. I've been going to US almost every 2 or 3 years, or maybe less than that, and practically every time we would meet. And when he was doing his MLE, said on the lighter side, while reading psychiatry. So I used to prompt him. He would say, I can't read this subject. Then we will do it together. Like, I'll ask him questions from psychiatry. So we have that kind of relationship, and later on everything we all know, and to the top position in the entire globe which he holds today. So, ladies and gentlemen, I am sure that today most of the senior faculty members, the alumni who are connected, would like to hear from something about his phenomenal work and maybe an occasional anecdote. Thank you very much.
Thank you, Anish. Thank you, Dr. Theeman. It's been a true honor for me to be part of this alumni event with Sanjay Gandhi. For the current faculty, current residents, and the students who are there, I can sum you up in one slide that everything you need to learn to do what you need to do in your medical career, I think you will learn in these 2 or 3 or 4 years while you are in Sanjay Gandhi. After that, it's just coming back to the same principles, coming back to the same advices which your mentors gave, and just reinventing yourself and adjusting the course. I have been very lucky. I had a chance to be the first batch of an MCH from Sanjay Gandhi. And as Professor Thiemann mentioned, he was my neighbor. Everyone distinctly remembers him for his passion for medicine, his excellence in taking care of patients, but his understated and humble approach towards life. Dr. Radha was a close friend, and I still remember his smiley response to the questions which we used to ask. Every time we had a GI consult, he was the one who was taking care of things. And the transplant patient he mentioned, I will get back to it a little later. Professor Demon, this is an outstanding start which you have done, because this is one way to magnify the impact which a lot of us, 200, 300, thousands of us, which are all over the world, we have our roots very closely tied to Sanjay Gandhi, and we really owe our growth and everything to that institution. So the fact that you are initiating this new model, I think it is really commendable for you. Thank you. I had just finished MS surgery from GSVM Medical College under leadership of Professor Tarachand, and my examiner was Professor S.P. Kaushik at that time. He was kind enough to give me a boost. And with his motivation, I ended up doing a pool officership at All India Institute of Medical Sciences with another legendary figure, that was Professor Samiran Nandi, who was a England-trained surgeon who came back to AIMS and brought in academia and surgery together. Very soon, however, I realized that my passion was towards urology, and I just walked in to Sanjay Gandhi in sometimes in mid 1988. And that is where the start of my journey started in urology. And then one single individual who changed the course of my trajectory was Professor Bhandari. I cannot forget the first interaction I had with him. The administrative block where Professor Thieman's office is, that is where Dr. Bhandari was unpacking his boxes which had just come from JIPMER. And I had no appointment, no emails, no cell phones, no secretaries to coordinate. I just had a motorcycle, so I drove from Kanpur to Lucknow. And there I was knocking on his door. Then he was almost on a table trying to hit the fan so that the fan can start moving, and his all the boxes were around. He was so kind. He was so inspirational. He sat down, he listened to me, and he said, "You know what? I have just come yesterday, and you really want to be here because the department doesn't exist." But then you said, "Okay, let's meet maybe in 1 month time. If you are still interested and if I'm still there, we will talk about it." And that led me to come back again in about a month time. He said, "Okay, come over. You already have a pool officer's job. Why don't you come over and start here? We don't know whether there'll be MCH or not. And if anything, there will be only one seat of an MCH. And we already have a star resident who had joined us, and that was Professor Anish." So I said, "Okay." We moved in there. He truly is a visionary. He sees things far beyond before they are happening, and he has an attitude, why not? And then that why not is what has led to urology department at Sanjay Gandhi to become one of the premier institutions in the world. And I was lucky to be his part of two first MCHs at Sanjay Gandhi. I distinctly remember that he saved me from getting into the principal's office because I was caught driving his own car in the main hospital lobby because we were moving cystoscopes and PCNL equipments from the general hospital to the main hospital, and there was no other way. So I was driving the car in the lobby, and Dr. Sethi's team caught me. I was in trouble, but then I was bailed out by Dr. Bhandari saying that, you know what, there is no other way to do a special operation next week, and he was just helping me. I also remember the first transplant. The first cadaveric transplant was done under his leadership at Sanjay Gandhi. And my only role was that I was from Kanpur and I had a motorcycle. And I could get to the recipient possibly faster than the phone or anything else could happen. So my role was that. And after that, we somehow managed to get that patient there. The first successful transplant was there, first PCNL was there. So many firsts happened under his leadership. And then he and I continued collaborating together, and he and I wrote a paper on transplant and whether the transplant is only 100-year-old. And he was trying to bring in that Lord Shiva had done the transplant first time in the Ganesha's thing. So that paper was published, and that is one of my prize papers with Professor Bhandari. Not only that, Professor Bhandari was instrumental in my career. His wife had a role. Dr. Sushma Bhandari, I can owe my getting fellowship at UCSF, which was next part of my journey, goes credit to her because we didn't have phones and PGI at that time. And somehow I had written letters to many people, and one of them was kind enough to call from San Francisco to PGI to Dr. Bhandari's home. And we had an internal phone. So Dr. Bhandari's wife had an one phone with an international call, and she plugged in with the internal phone with my apartment, and I could first time talk to the residency director and the fellowship director. And the atmosphere was like a family. The attendings, the faculty, they really cared for us, and we were very lucky. And Dr. Srivastava, who is the chair now, was not only my colleague, he actually taught me how to do cystoscopies. There were times I will not know which end of the scope used to go inside the body. I was a general surgeon. I had never seen the complex urology, and he was a very well-trained urologist at that time. And there have been many episodes in which I used to call the attendant to go and fetch for Dr. Anish so that I can find the stent which I was supposed to remove. And Dr. Anish would come, and very quietly, in his manner, he will take it out. Anish and I have stayed connected forever. He was one of the teachers as a colleague for me, and the rest of the team of my fellow residents. This is the team of Divakar and Anil Elhens and Gautam Banerjee and Rakesh and Vijay and Vinod Mishra. So these were the three batches with the first, second, and third batch. And they did a lot together. We never had a better time. We would work hard, but we were never tired. We were never sad. And each one of us was taking care of each other. Dr. Rawat and Dr. Anand Kumar and Dr. Rakesh Kapoor were other three faculty, and we could see the wisdom which was coming from PGI Chandigarh and All India Institute of Medicine, and we were lucky to have a combination of knowledge by two or three premier institutions in the country. I finally graduated in 1992, and Dr. Bhandari's help got me a fellowship first in Royal Liverpool Hospital for the transplant. But that was not my destination. I wanted to come to United States. And the first call which had come was by Dr. Perry Narayan, who was a faculty at UCSF and also at the VA hospital. I became part of his team. Very soon, he got appointed as a chief at Shands Hospital in Gainesville, Florida. And before he moved me. I transitioned from being a surgeon to, for a few years, not doing surgeries at all. And this was my prized office. My wife's picture is there, my son, my daughter, all of who came with me to United States in 1993. And this is my office. I got quite involved with research, and Dr. Narayan was the instrumental force in teaching me that. Evolved from a surgeon to starting to talk about artificial intelligence and neural network. Then the next shift happened in my career. And the history goes again back to the time I had spent at Sanjay Gandhi. One of the visiting professors was Dr. Menon. Dr. Menon was chair at UMass when he had visited us at Sanjay Gandhi, and this is a picture from that time. And then he just moved to Henry Ford Hospital as a chief. As the chair of urology at Henry Ford Hospital, he was looking to recruit some people, and I was available. At that time, I was not thinking about doing any further training in United States. I had plans to go back to India. And Dr. Menon was looking for a researcher and a surgeon scientist. And I got a position with the Josephine Ford Cancer Center there. And Dr. Menon was kind enough to offer me that. He became my mentor. And during that time, things evolved. He wanted to change from an open radical prostatectomy to a minimally invasive prostatectomy. And that led me to go and spend about a month in Paris with the straight laparoscopic surgeon like Bertrand Guillaume and Valencian. I learned the straight laparoscopy, came back, a robot came, and Mr. Vaticuti endowed the department with some significant funding, and Da Vinci Robotics started. I just distinctly remember first 1,000 cases, which I did at Henry Ford. It used to take almost whole day, but by the time I was leaving, we were able to do 4 to 6 cases every day. That time at Henry Ford under leadership of Dr. Menon, being part of the robotic program, and then finishing my residency at that during the same time in parallel, led me to become involved with the surgical part of it. So I learned about the data and the science and a lab before I came to Henry Ford. I got involved with making the surgical drawings and understanding the fundamentals of what operating field and operating science should look like. That led me to get quite involved with the first few and possibly many critical papers on the robotic prostatectomy. And these are the papers in early 99 and 2000s. This passion towards anatomy also led me to lay down the foundation for evolving the anatomical studies for prostate cancer using a robotic platform, moving on to the same theme which Dr. Patrick Walsh had done for the open radical prostatectomy. Dr. Jay Smith and I got together, who was the chair at Vanderbilt, and we wrote a book on the robotics and urological surgery early on. We wrote a book on prostate cancer, a comprehensive perspective. I became a professor professor and endowed chair at Weill Cornell Medical School. And at that time, I got involved with developing the robotic technique. I will bring my discussion towards the field a little bit, but I will keep it general for everyone to understand. Prostate cancer is one cancer in which a surgeon gets judged not by what he or she takes out, because we have to take the cancer out. But this is an organ which is very closely attached to the nerves which control the sexual function and the muscles which control urinary control. So having a negative margin is critical, but doing that with preserving a sexual and urinary function was another very important milestone. So these are 3 operations in one. Surgeon has to be a cancer surgeon along with a neurosurgeon and a reconstructive surgeon. So we started doing some fundamental work on redefining the anatomy, and we came up with the concept that actually this nerve plexus around the prostate may not be just like a rope, but like a hammock. And we developed techniques in which we can delicately dissect out the cancer and still maintain and preserve the sexual function. This is one of the videos from that time. We recently evolved into developing a newer way of preserving the anterior control structures, which allow urinary control to come back much earlier. And this is known as a hood. And this is one of the drawings which me and my lab did. Dr. Patrick Walsh was another motivating figure for me all along, and having gotten involved in a prostate cancer journey, he is a legend. And just a couple of years ago in 2017, he and I reconvened back together, and it was a true honor for me to give him a Lifetime Achievement Award at New York. I have to say that when I was in Sanjay Gandhi, I knew a little bit about urology. I knew a little bit about prostate cancer, but I had never done a radical prostatectomy. I'd never seen a robot. I'd never heard about artificial intelligence. But what I had heard and learned there, that anything is possible. Just put your mind together, think about the ways it can be done, never be outworked, and things will happen. And that exact recipe has brought me so far, and I'm really excited. But there was an inflection point. Very soon I realized that, like in any cancer, not everything can be tackled by a knife, and in my case, by a robot. And as a surgeon scientist, I cannot just delegate everything else to someone else to tackle or figure it out. And we realized that there is a lot which can be learned at the molecular level, at the genomic level. So these are the first 7 patients who ever had their whole genome sequenced. And I was part of that team. These were all my patients. I had insight to kind of collaborate with the team members, and we did the whole genome sequencing and realized that prostate cancer may be of different biological method. They may be different. One may be sugar addicted, other may be hormone addicted, and third may be inflammation driven. And understanding what kind of a driver this individual patient has may prevent cancer from coming back. Then came a concept about imaging, and we got quite involved with the preoperative and then intraoperative imaging, realizing that a multiphoton microscopy and a multiparametric MRI both can help us in making our surgeries more precise. And this work started happening in my lab. So evolving from a pure surgeon to a surgeon scientist, leveraging our knowledge about the data sciences, artificial intelligence, evolving into the genomics, then into the imaging, and then finally into the immunotherapy programs, has helped me in keeping this program my own caliber, my own knowledge at the ahead of the curve. And now of late, we have been looking at the mind-body connections with our own Indian physician scientist, Deepak Chopra, to see if mind and body and inflammation and diet and exercise can have an impact in the cancer outcome. So in a nutshell, what I'm trying to say is that what you are learning in Sanjay Gandhi is critical for your rest of the life. You just need to figure it out, how to evolve, how to keep in touch with your mentors, how to relearn, how to reinvent yourself. Tools you already have. You just need to put in an energy, sometimes sit down and kind of reflect upon, are you going into the right direction? Good things are bound to happen. And in my case, I've had a different kind of a journey. I very often was known as Jack of all, master of none, very early in my career. And when I came to the United States, I started thinking about kind of reversing that mindset. And I started thinking about one organ, and that organ became my life's calling. And I want you to remember one thing, that the hedgehog concept is that there is a story goes out that the fox and a hedgehog animal, which you can see on the left, have been fighting with each other for a long time. Fox knows many skills, tries to attack on that hedgehog many different ways from different angles. Hedgehog is very simple, knows one thing. And that one thing is that that hedgehog can roll down and put his spikes up. And when the spikes are up, no one can touch no fox can touch. So that's been my model. I will not do a kidney transplant. I will pass on a kidney stone to my colleagues. The stricture urethras will be handled by someone else. The bladder cancer, I have Peter Wicklin. But when it comes to prostate, that's what I know. And I also know there is a lot more I don't know right now. And as a surgeon scientist, I want to collaborate. I want to learn from other experts, from the basic scientists, from the immunotherapists, the trialists, the imaging experts. And that is what the mindset I would encourage the new residents, the new faculty, the new fellows to have. You can evolve and be a surgeon scientist, and that has been my journey. I was also given a cue towards that what can we do for Sanjay Gandhi, which has given us literally everything which we have become. And I would say with Professor Theeman and the leadership of the institution, many of us can help, at least from an international standpoint. There isn't such a luminary faculty, luminary alumni from India itself and from UK and other parts of the world. But from an international and in a US standpoint, we could be your ambassadors. We could help you in raising funds for doing fellowships, and we can help in establishing professorships. I have listed my email, my personal cell phones right there. If someone has a question, someone never has a dream, someone just wants to pick up my mind, I'll be happy to be available. And I will conclude this session by thanking Anish, thanking Dr. Bhandari, thanking all my mentors, and especially Dr. Theeman for having this vision of establishing this new initiative. Thank you very much.
Thank you, Ashutosh. Thank you very much.